Hey everyone, welcome to Open. I'm Rhina Valentin, your host of Café con Leche for the next hour, encouraging you to get social with us online. That is, tweet us and follow us on Instagram at BronxNet TV and like us on Facebook at Open BronxNet Television. And of course, while you're there, follow moi on Twitter, FB, Instagram, Insta Stories, and LinkedIn at Rhina Valentin. So, children are officially going back to school, and while the Delta variant continues to surge throughout the United States, many parents, like myself, have questions on how to keep our kids safe and healthy for the school year. And joining us to provide some health advice for vaccinated and unvaccinated children, please welcome St. Barnabas Hospital Director of Pediatric Infectious Diseases, Dr. Carine Hedari.
Hi, thank you for having me.
Well, thank you for coming back. I mean, we were meeting, I think, this time last year, right? I believe the conversation was different. However, it is such a pleasure to have you back on to help us navigate through this next chapter.
Same here. Thank you for having me.
So, Dr. Hedari, let's talk first about, let's say, for parents who are questioning the back to school scenario within itself, meaning back in person, for those who were strictly virtual. Let's just talk about the impact that's had on children over the past year and what you've been seeing with your patients with regards to the mental health.
Yeah, I mean, I think the impact is real. You know, staying home alone, especially with kids who have parents as essential workers who had to leave home for most of the days, I think that took a toll on a lot of kids. And we've seen like a rise in depression, a rise in anxiety amongst those kids. You know, also kids that had been struggling in school had been falling behind. So the impact of the pandemic has been real, both medically, socially, and mentally. And so I think it's very important to have our kids back in person, back to our schools.
Let's just talk a little bit about the impact of the mask, actually, what kind of effect that has on a person, right? I mean, within breathing in, inhaling, always, I don't know, just help us out with, I'm trying to also be realistic. I'm even speaking to you somewhat as a parent that's concerned of my child wearing a mask all day long, every day.
I have a 3-year-old and I get the challenges, but I think that, you know, masks are important, right? So especially for 12 and under, who this is pretty much the only barrier that we have against the virus, in addition to social distancing. So I think that it's important. It's probably, you know, uncomfortable for a 3-year-old. Of course it is, you know, they're better off without it. They can communicate better. They can understand facial expressions. But I think, you know, the risks associated with mask wearing are much, you know, less than the risks of, you know, having those kids exposed to the virus, obviously. So what I do recommend to parents is that they talk to their kids about the masks. Make sure that they choose a mask that the kid is comfortable with, like have him choose the color, the design or whatever. Make sure that these masks are well fitted. So there's no point in, you know, making that kid wear an N95 if the fit is poor. You know, better have a mask that is, you know, cotton made or whatever, but that fits his face. And talking to the children, and I think that children are very receptive for the most part, and I think they mimic our behavior. And if we show them that, you know, this is okay, you know, they can do it.
And so, because we're talking about adaptability and the virus itself is adapting, and which is why we have this new variant, right? So let's just talk about how that, what that looks like in 2021 now.
I mean, we do have that Delta variant that we're facing, unfortunately. We know that the vaccines are pretty effective at preventing, you know, severe disease and mortality. So we know that it does what it's supposed to do. There are some breakthrough infections, but that's the price to pay with the vaccine with the virus that's evolving. And so I think that, you know, the Delta variant risk is real because it increases the infectivity of the virus. But we have a lot of ways to mitigate spread, including, like you said, mask wearing, including having kids socially distance at school, so like those 3 feet rule, and making sure that everybody around those kids are vaccinated. So it is true that 12 years and below are not able to get vaccinated at the moment. We're hoping that it will happen soon, sometime soon in the future. But for the moment, making sure that there's a bubble around them and making sure that all the adults that are around them are vaccinated, including teachers and staff, I think that that's very important.
And so, again, we went from 6 feet to 3 feet. So why 3 feet now?
Well, 3 feet because for droplet precautions, which is the way the virus transmits for the most part, 3 feet was shown to be enough. And so we're doing that 3 feet, and that's part of the science evolving, like you said. So, you know, we learn more and we change things that we were doing. So 3 feet is okay now for schools. I think that very important is to make sure that your school has a good ventilation system, so their AC system up to date, have like HEPA filters ideally in the school to improve ventilation, because we know that there is some part of the virus that can transmit airborne. So part of the parents' responsibility is to make sure that, you know, these rules are taken care of and that the school is observing these measures in order to protect the children in their schools.
And so before we go, because again, we're talking about minors that are reliant on adults assisting them with even their hygiene, like what would you recommend to parents in conditioning their children? I mean, by now they should all be conditioned, but you know, at a certain age, they still need to be reminded to wash their hands, to sanitize, to, you know, all these additional like behavioral patterns that really are just our new norm. How would a person feel comfortable, or a parent feel comfortable knowing that their child is exercising those practices in their absence?
I mean, again, I think that the most important part would be teaching that child to keep that mask on, you know, as much as they can. And understandably, you know, 3 years and, you know, 2 to 3 years are going to be the most difficult group to have that happen. But also pack, you know, hand sanitizers with those kids. So it's not, you know, possible all day for them to have access to washing their hands with soap and water. And so packing hand sanitizer and, you know, instructing them to do that before and after meals, I think is very important. And sanitize as they go. So it'll be masked and really sanitizing with alcohol rubs, essentially.
Right. Yeah. Thank you. Dr. Hedari, did we miss anything that you feel we need to discuss with regards to just reassuring everyone that it's best for the children to go back to school in person?
No, absolutely. I think it's very important. I have a 3-year-old again, and I think that, you know, her getting back into social habits and having, you know, friends at school is very important for her learning and for her social learning as well. But I think that we should learn from last year's mistakes. I think that, you know, for the most part, people are letting their guards down because we have this, you know, false feeling that the pandemic is over. We're in a better shape for sure, but I think that you know, we shouldn't really let our guards down. So use the tools that we learned that work best. So masking, ventilation, and vaccinate everybody around these kids, I think is the most important tools to keep them safe and have them, you know, be in person this year.
Thank you. Thank you for sharing it with our viewers. That's Dr. Carine Hedari from St. Barnabas Hospital, Director of Pediatric Infectious Diseases. And you guys, for additional safety tips on back to school preparation, you can also visit cdc.org and of course sbhny.org. All right, we have to take a quick break, but when we return, we'll hear about a program offering vegan food to your local bodega. Don't go anywhere.